Apologies for the quality of this video because I'm filming on my phone. I want to apologise in advance because I can't stay serious or focused for longer than like 2.5 seconds, and I know I'll be talking about some sensitive topics and I don't want to offend anyone by making it seem like it's not as serious as it is. It is really serious. Video for attention or anything. I just want to make a video to help anyone who's in my position or in the position I was in like 3 or 4 years ago when I first got diagnosed, because it can be really hard. And I also wanted to make a video for people who haven't experienced a long-term condition or are around someone who has and want to know how to better support them. I also wanted to make this video sort of more general, so helpful if you have a different autoimmune condition or a different long-term condition to me. So if I sort of generalise what I'm saying, it's not because I think I know everything. I'm not a doctor. I just want this to be helpful as many people as possible. So I first got diagnosed with arthritis when I was in year 10, and it's quite a strange age to get diagnosed because either arthritis sort of shows itself and you get diagnosed when you're really young, or you don't really develop it until you're in your mid-40s and you're older. And the hardest things that I found about it was that I couldn't find anything about anyone my age experiencing arthritis. I mean, I only know one other person who has arthritis, and it's like a different type to mine. They are similar in some ways, but the different types of arthritis do affect people differently, and even the same type of arthritis affects people differently, and that's why it's hard to just like read a leaflet and feel better and know everything. We got diagnosed with spondyloarthritis, which is different to rheumatoid arthritis, which is arguably like the most common type of arthritis. And rheumatoid arthritis is when your immune system attacks the cartilage in your joints, and that causes pain and inflammation because your bones are rubbing together, and that is an autoimmune disease, and that's classified as an autoimmune disease. But spondyloarthritis is a little bit different. There's debate about whether it's an autoimmune disease or just auto-inflammatory, because spondyloarthritis doesn't affect the direct joints. Spondyloarthritis affects it can affect the joint, but it's more to do with like where the tendons and the cartilage meet rather than two bones. So that can lead to more generalised pain, which can sometimes make spondyloarthritis harder to treat than rheumatoid arthritis. But they're just different. Like, there's not just one type of arthritis, and I think that's a really common misconception. It's not all the same, and it can affect people very differently. Spondyloarthritis is the umbrella term for a group of arthritis that affect your cartilage, your tendons, your ligaments. It's sort of everything rather than just bone. And there's like certain types within that. There's reactive spondyloarthritis, psoriatic, juvenile, AS, which is slightly different but it classes under spondyloarthritis. And AS is short for something that I can't say, so I'm not going to try and say it, but it's like ankylosing spondylitis, and that's the main type, and that's most likely what I have. But because I'm so young, it's really hard to diagnose and put yourself into a category. So my diagnosis at the moment is spondyloarthritis. So I think that's like something that can be quite difficult, like diagnosis. Diagnosis can take a really long time, especially in young people with arthritis and autoimmune disease, because it's less common in young people, and so it can often be diagnosed as something else, and it can just make the whole process a lot longer. So for example, with my diagnosis, when I was in right at the end of year 9, I think, so I was about 14, I was getting really bad chest pain, like it was really sensitive to touch, and I'd walk through the corridor, and if someone knocked into me, it sort of got to the point where I would get like so sore that it would be swollen, like my collarbones, just if someone bumped into me. So obviously I went to the doctors for it. He first diagnosed me with asthma, which I do have, and that's completely different, and he also diagnosed me with suspected costochondritis. And costochondritis is not arthritis, but in some ways it was similar to what I was experiencing, so it was like a fair diagnostic even though it was technically the wrong one. So costochondritis is sort of like a secondary, I guess, infection of your cartilage in your rib cage that you get after you've had a really bad cold. But it's more common in like adults. To be safe, the doctor that I went to in my village, he referred me to Addenbrooke's Hospital, which is in Cambridge, in case you didn't know. And I went to the cardiology unit to check if like my heart was fine, because when anything to do with your rib cage, like they want to make sure that your heart's fine. So I went there, and the guy in the cardiology place examined me, and he said it's really weird that he's referred you here, because this hasn't got anything to do with your heart. It's not the inside, it's the actual bone of your rib cage. So he referred me to rheumatology clinic. This is like, because NHS appointments take a long time to get through. This is like a year after I've been to the doctor and I supposedly have costochondritis. And at this point I'm sort of taking ibuprofen, because ibuprofen's a painkiller, but it's also an anti-inflammatory, so that's useful. And it's getting more and more unlikely that I have costochondritis, because it's only supposed to last like a month, a couple of months, and obviously I'm still experiencing the same pain because it's not costochondritis. So I get referred to rheumatology and I go to an appointment, and within like 20 minutes the doctor's like, yeah, you've got spondyloarthritis. It's really like all your symptoms match up. All the places you experience pain are where you'd experience pain if you have spondyloarthritis. And it's just like you've got to go on that year-long journey to go to different doctor's appointments to narrow down what it is. And because appointments take so long, like there's like month gaps between your appointments if you go to hospitals that are on the NHS, just because the NHS is under so much stress. So it took like a whole year to get to that point where I've been diagnosed. And in that whole year I've been taking ibuprofen every single day, 4 ibuprofens, double strength, so 8 ibuprofens a day. And so firstly, that's not that good for you, and secondly, it stops them working. So now I can take like double strength ibuprofen now and it does nothing for me. And that's like one of the problems with going on not private healthcare. It just takes a long time, and sometimes it can cause problems, because now I can't treat my arthritis in the way I should with ibuprofen because it doesn't work for me. So I have to turn to a stronger drug. And if I'd been diagnosed with arthritis straight away, I could have used the ibuprofen in a better way, not taking it every day, but only when I was in pain or before I was going to exercise, to prevent me like swelling up, and that's what causes the pain. So yeah, I found that a bit hard, like in my diagnostic journey. That was probably like the hardest thing, finding out that I've been taking the wrong medicine, and that was now preventing me from getting better because that medicine doesn't work for me anymore. So when I got to the so anyway, the guy in the rheumatology clinic diagnosed me with spondyloarthritis, but obviously I still have to go to the rheumatology clinic, not any other clinic, because there is no spondyloarthritis clinic, because it's not as common. I apologise for that noise, I do not know what it is. I'm so sorry for being an unfocused mess. I do not know what was wrong with me while I was filming this. Because there is no spondyloarthritis clinic, because it's not that common. But the well, I don't know, I think there's more types of arthritis. I don't want to sound like there's only 2 types. But these spondyloarthritis and rheumatoid arthritis are in some ways similar. The treatment is quite similar, the symptoms are in some ways similar. And so it's not a big issue for me to go to the rheumatology clinic. That's just the general name for the arthritis clinic. So don't get confused, I do have spondyloarthritis, not rheumatoid. When I got to the clinic, he basically told me some stuff about spondyloarthritis, because obviously I'd never heard of it. And I'll just tell you basically what he told me. He told me that spondyloarthritis affects not just bone, like tendon, cartilage, like what I've told you. And it also is genetic, but it's very easy to be a carrier for it. So a lot of people have spondyloarthritis or autoimmune diseases or types of arthritis, and they pass that on to their children, but they never get diagnosed with it, because if there are no other genetic factors, or environmental factors that are like working alongside the arthritis, and the arthritis isn't that bad. You can live a perfectly normal life. You can not even know you have it. So it's really easy for it to be passed on, and you don't know you have it, and none of your grandparents had it, and then you just get unlucky and have another genetic condition that works together with it, and that brings out the arthritis, and they play off of each other and make each other worse. So the reason that mine is bad personally is because I have hypermobility in my joints, which means my joints bend further than they should. Like, you can't even really see. But when he was examining me, it was quite clear, like, you're very naturally flexible if you have hypermobility, and you can be fine with hypermobility. My mum has it, my brother has it. They're completely fine, but because I've had arthritis passed on to me as well, the arthritis and the hypermobility play off each other. Because my joints, if I sort of like bend them too far the wrong way, which is really easy because I have hypermobility, that's even more stress on the parts of my body that are already inflamed, which can cause them to swell up even more, and that just causes even more pain, and they sort of work off each other and they bring each other out, and that's why you can sort of live with spondyloarthritis and never even know you have it. I don't know if that's the same with rheumatoid and other inflammatory diseases, autoimmune diseases and stuff like that, but I think that's quite common. Like in rheumatoid arthritis, I think they do normally come alongside another condition like Raynaud's. Then yeah, but I don't know a lot about that. It also cannot be sort of cured by like a knee replacement or a hip replacement for obvious reasons, because it's not the hip that's the problem, it's the juicy bits that are all attached to the hip and how the hip is made that's the problem. And also I'm way too young to get a hip replacement because I'm still growing. So it was kind of, that was one of the hardest things about being diagnosed, was just being told that, well, I couldn't start like the low level medicine because it didn't do anything for me. The ibuprofen doesn't do anything for me. And also that I'm going to have to live with this forever, and that there's no sort of surgery that I can have that will make it better. I think they were the hardest things to sort of accept, that okay, I've got to like live with this forever. And it's quite hard to motivate yourself to do the things that help you on a regular basis, because I remember feeling sort of like, why should I have to? Like, why should I have to take medicine every single day just to feel like how a normal person feels? Like, why should I have to go to the gym or go swimming every single day just to get to a point of strength that a normal person's at? Like, it's quite hard. And I think if you're like around someone who's going through that, who's just been diagnosed, it's really good to be like sympathetic towards that. Like, that it doesn't sound like a big thing because it's not life-threatening, but it is life-changing, and you just have to bear with someone who's going through that, because it's hard. It's hard to know that like you're not normal. It can make you feel really isolated as well if it's a condition like mine that is not really ever talked about, especially for young people. It's never talked about, and it's very invisible. I want to like talk about that now, how it's sort of like an invisible illness. I'm gonna insert some pictures of like the level of swelling that I get, because it is quite a lot. But the thing is, unless I'm wearing like a swimming cosy, you're not going to see that. You're not going to see that like swelling, that inflammation. If I'm just wearing my normal clothes like this, you can't tell with my elbows like a balloon. You didn't know. And I think that's like one of the hardest things. You don't look like you're in pain, but when you're in pain, it comes alongside feeling really sort of like tired, really down, and that can be really hard, because if you don't even know that someone has a condition, you don't know that they're not just being moody, you don't know that they're not just lazy, and that's what it gets interpreted as sometimes, as you being lazy, because you don't want to, it's a private thing, you don't want to tell everyone that you have this condition. Says me making a YouTube video. You don't want to tell everyone that you've got this condition, and that's fair enough. People don't know you have it, people just think you're lazy, and it's hard. It definitely is hard. I remember before I really told anyone about it, sort of like a year ago, I would go to like, I had
you want.
I remember before I told anyone about it like a year ago, it was at a really bad stage for me, and I was the like fatigue and it just made me feel really down because I just tried another new medicine that wasn't working for me, and I just was in pain all of the time, and it was really hard. And so often, not even often, like I wouldn't come to lessons once in a while, and I had one teacher and he would make a really big, like he would be quite salty about it. He'd be like, oh, Evie couldn't be bothered to come to lesson again, and that can be really hard because it comes across like I don't care about my education. I can't be bothered to come to someone's lesson. I'm not grateful for someone to be teaching me. But I actually am. I just can't physically make it into school, and that can be really hard because if you haven't gone through that, you still don't understand. Like, it's all fine telling someone, oh, I've got arthritis, I can't come in today, I'm in pain. They don't know what that's like. It's like just little things like that when you're already feeling really tired and really down, that can be really hard. So I'd say if you're like around someone who has a long-term condition, I think you just have to be quite patient. I know it can be really like trying, and there have been like people in my life who've been like, you're too much, like I don't want to deal with it, because when you feel like that, all you want to do is like unload on someone to come and look after you. That's what you want, and I think that's too much for people, and that's just life. But it shouldn't be like that. It should be more talked about, and that's sort of why I wanted to make this video.
Sorry guys, I had to go get my cat because she was crying.
Oh, making your debut. Thumbnail. I was talking about when I got referred to the rheumatology clinic and I got diagnosed at the end of year 10. I was 15, and when you get diagnosed you have to do 3 sort of things. The standard things is getting blood tests, because arthritis shows up on a blood test, and MRI scan, I think it is. I don't think it's a PET scan. It's an MRI scan, and also x-rays. So my blood test came up positive, and my MRI scan was all okay. They do the MRI scan to make sure that you haven't caused yourself any damage from having arthritis, like you don't have any injuries that are outstanding that can cause problems. So I didn't in my muscles, which like the juicy bits that the MRI scan looks up, I didn't have any of that. And then they took x-rays of my pelvis, back and neck, because with spondyloarthritis, I talked about it, the main type is AS, and that really affects your neck, your back, your pelvis, and in really serious cases it can fuse your neck and your back. And so it was really important to get those x-rays, and I got those x-rays, and that was probably like the hardest point of when I got diagnosed, because my x-rays came back and my pelvis, where my spine met my pelvis at the back, I'd had so much inflammation and so much swelling like in the past. I mean, it had always been a place where I got quite bad pain. The thing was that I didn't think it was that bad because the swelling was really like inside my back, like it didn't stick out like other places do when they swell. And so I didn't know that it was as bad as it was, but my pelvis, the bone of my pelvis had essentially disintegrated. Like the top bit in the x-ray is just fluffy, because so much swelling can just, like over like 15 years, can just really damage your body. And that's why I think it's important, like if this is like sounding like something you have, you should go to the doctors right now, because if you don't take the proper medicine for it, you can do yourself a lot of damage. Like I've done that damage to myself now and I can't fix it. What I can do is take medicines that stop me becoming inflamed so it doesn't get any worse, and it could potentially heal if I don't swell up for like the rest of my life, or like a long period of time. But the problem is it can never heal, because you're never not inflamed. You're always slightly inflamed if it's that bad, like in a joint. And I remember finding that quite like shocking. Like it's not just a few aches and pains, it's like real damage to your body. And I think that can be quite hard. Like I'm sure it's similar with rheumatoid arthritis. Like you can see like the impact that it has on your body, and it's not just like a little thing. It's not just, oh, my knee hurts today, or my back. It's like serious. And I think that's like a misinterpretation. Like when you think of arthritis, you think of old people like not being able to get out of their chair. You don't think about like a young person whose pelvis is like disintegrating. And that's just because no one knows that that's how serious it is. No one, unless you go through that, you don't know. So finding out that, they sort of realised that my need for medicines that were a bit stronger was quite important, quite urgent. So I started taking, wait, I'll get them out. So just for reference, this is the ibuprofen that they referred me to. Oh, my hand's so shaky. So ibuprofen is like the name, if you've heard of Nurofen, that is ibuprofen. Nurofen's the brand name and ibuprofen's the drug. So this is not the same as taking a couple of Nurofens. It's still on my prescription because in theory it should still work a bit, and it sort of does, but it doesn't work that well, so I don't take it that often because I feel like I've taken it so much that shut up, Fred. I'll show you tablets. Oh my god, that one's empty. So what the tablets look like. I'll get one out. They're like little pink tablets, and this is like, one of these is like 2 ibuprofens, and I got told I could take 4 of these in a day, so that's 8 ibuprofens. And like, to sort of describe the pain to someone who has never experienced it, I took 8 ibuprofens a day and I was still in a lot of pain. I mean, on some days it's better than others as well. Like on some days I used to be able to take ibuprofen, I used to be able to take like 2 of those and then my pain would be alright. But we're not in that place anymore. What I got prescribed from the hospital was, firstly, just throwing them across the floor.
Codeine crazy.
Was codeine tablets, which they sort of worked. What they did was they made you feel good. They don't help with the pain, they just stop you thinking about the pain, make you feel better. And to me, I didn't really feel comfortable taking it. That's not what I want to take medicine for. I don't want to take medicine to make myself feel better and still just like do nothing for my body. It's really easy to get addicted to codeine tablets and to get dependent on them. Like, you're not supposed to take codeine more than like once a week. And for me, it just doesn't feel worth it. Like, ooh, treat myself to a bit of codeine. And so after that, I've just got out 2 packets of codeine, BRB. Because that didn't really work. They didn't really do anything for me, and I was just feeling a bit rubbish because codeine wasn't working. So I got prescribed naproxen, which is a lot stronger than ibuprofen. Let's just say that. And naproxen is also really addictive. You're not supposed to take it more than 4 days a month, and like, people become really dependent on it, and that kind of scared me. I don't want to become dependent on a drug. Obviously these are a lot stronger than ibuprofen. You have to take them with a meal, and they have quite a lot of nasty side effects. So I'll sort of talk about my experience with them. So these are what they look like. They're quite big and chunky.
I like them big. I like them chunky.
But when I took them, I took 1 to start off with. Obviously I'm really small, like I don't weigh very much, I'm really short, just a small person, and like it says you can take like 1 up to 4 times a day, but if you think about that, that's an adult dose, which is like a dose from anyone who's like 5'1" to like 6'7", and it makes a difference like how big your body is to like the ratio of how much medicine you're actually having. So when I took the 1, it was too much for me, and it made my side effects really bad as well. So like the common side effects are like stomach ache, headache. I got ringing in my ears. Like, the thing is that those side effects are so horrible, but it works so well. Like, I remember taking that for the first time, and it was the first time I'd ever just like not felt in pain. Like I still had a couple of aches and pains, but it does work, but the side effects are just too much to handle. So I tried taking half of one of these and I did still get side effects, but they weren't as bad. But then at the same time it didn't take away all my pain, so it just didn't really feel worth it. So I mean, on a really bad day I think I'd take half, because it does take a bit of the pain away. It just didn't really work for me like as well as I'd want it to. Oof. I reached the maximum length of video that I could record, so the camera's probably moved. So I went to nurse, I was like, these medicines aren't working for me, I want to try something different. So she referred me to hydro and physio, and I'm not going to lie to you, I don't like exercise, it's not my thing. There is a theory that if you are really fit and in shape, it can help with your arthritis pain, especially if you have hypermobility, because your joints are getting stronger and you're more likely to move in the normal range of your muscle, like your joint. So it's going to make the hypermobility better, and therefore your arthritis a bit better, and you're also stronger, and it'll make you feel physically better. And I can't lie to you, I hate exercise. I've tried it and it's not my thing. The thing that I found hard is that you can't choose what exercise you want to do when you have arthritis. You have to do a low impact exercise, and that's essentially swimming or yoga. For me, I can't really, there's probably like walking, it's not really my thing. And I've tried it, and what I find, this is what I found with physio as well, it gets to the point where you're exercising, you can either exercise like once a week and it will take forever for you to feel any difference, or you can exercise like every day and you're going to end up in so much pain you're barely going to be able to exercise. And for me, I found it really hard to find a middle ground to a point where I was exercising the right amount so I wasn't causing myself to be crippled, to actually feeling a difference. And that's why physio never really worked for me. And I know it works for a lot of people and it might be different for different conditions, but just for me it never really worked. And hydrotherapy I found slightly different, because it did make me feel a bit better, because you do it in a really hot pool. It's like 35 degrees I think, and it's sort of like physio but in the water obviously, and it's a lot. The thing that I find is when you're doing it in the water, because the water's so warm, you can't feel the pain while you're doing it. And for me that was really good, and I really like that. And there would be some pain afterwards, but it wasn't as bad as if I'd just done straight exercise. And the thing is, I really liked it, but you only get 4 sessions on the NHS, and it's really expensive to do it anywhere else. Like, you can do it yourself in a hot pool for like about the same amount as it costs to swim. But if I'm not doing a class, like I feel like I'm not going to be motivated to do it, and that's essentially what's happened. Is I've completely forgotten everything I did in hydrotherapy because it was so long ago. I can't afford a teacher to keep teaching me hydrotherapy, and I think that it should just be on the NHS for longer, because it's actually really, really helpful for me and I really liked it. So I'm gonna start swimming again, but I don't know, I feel like the same thing's gonna happen, but I feel like I should give it a try. Anyway, after that I went back to the nurse. I was like, this hydrotherapy, physiotherapy haven't really done anything for me, I need to step it up a bit. And that was like 6 months ago. It takes about 6 months to get another appointment, so she referred me to biologics, which is a type of medicine that it's an injection. This is a really, really simplified version of it, and it might be not 100% correct, but it's basically stops you producing the protein that makes your body swell up. So it causes less inflammation, means you can exercise and you get inflamed less, you get less pain, and you can exercise without being in pain, so you get stronger, and then if you ever do come off it, you'll feel better because your body's had time to heal, because you've not been inflamed, you've had time to exercise, and it's meant to be really good. So I went to an appointment a few weeks ago where I sort of got my introduction to it. They gave me this pack. It's got really confusing names. Like the drug is called it's called this basically. Like, this is the name of the drug, and then this is like the brand name. This one down here, it's called like adalimumab. And you get like a little pack, and it tells you about it, and she told me about the drug, and I'm going to start it soon, but the process is just long, and that is just part of going through the NHS. It's long, and I'm not blaming the NHS because they're under a lot of stress, and they are really good. The Addenbrooke's Hospital is really good, but it's just like, you hear all this stuff about the NHS getting money cut, and I think unless you're like in the position I am, or someone who's similar to me, where you need, like, you're quite dependent on the NHS, like you need to go back for appointments. It's not like just like you need the one-off A&E trip. Like, it's hard, and you can see like the stress that everything's under when you have an appointment in 3 months time that then gets cancelled and moved to 6 months time because there's an emergency, and that gets cancelled and moved to 9 months time because there's an emergency. And it's just quite hard. Like, you have to be really patient, and I think if you're, for like anyone who's around someone with a long-term condition, you have to just like keep supporting someone and make sure that they know that things are going to get better. It just takes a long time, it is a process, and it will get better. It's just quite long and hard. So yeah, this drug, I haven't started it yet, so if anyone wants an update, if anyone actually finds this video useful, I will actually do an update on it. But I'm quite excited to start it because they're meant to be really effective, and she said the side effects aren't too bad, which I need because naproxen actually destroyed me. So some other things that sort of help me that aren't medicine, that aren't physio, it's just like little things. It's just having a really good support network around you and being open with your friends. Like when I opened up to everyone about having arthritis on my private Insta, love you guys. Like the next day, Tasha brought me in like a heat pack, and Ruby brought me in like a little build bear. It made me feel so like good, so cared for, and it really makes you feel a lot better to have someone around you who's supporting you, who somewhat understands, even if they're not experiencing it, who's like really there. So shout out to anyone who's been lovely to me. I think that's really helpful, just to have someone to open up to have someone to complain to, because it is like, it can take a really big mental toll on you if you're having to like go through being in pain every day and feeling like you're getting nowhere. That can be really, really hard, and I feel like I've sort of made my way out of that cycle for now. But like before, when I was in it, it was really tricky, and it made doing things like GCSEs, going to school, stuff like that really hard. And it's not that I don't want to go into school, I do. It's that it's hard. I'm not going to uni this year, I'm going next year, and a lot of that is not because of my health, but part of that is to do with my health, because I'm starting this new medicine that can possibly have side effects. It might not, and it might not even work. And the thing with this medicine is that it can really affect your immune system, and I don't want to be away from my like support network while I'm going through that, because I don't think it's going to be particularly easy. But like at the same time, I'm not going to let it hold me back. I'm still going to go to uni next year, but I want to have a year to recover, to get on track, so that I can go into uni and like do the best that I want to do. I mean, obviously there are other reasons why I don't want to go, but that's not what this video is about. This is not a life update. Anyway, other things that really help me, I've got a selection of things here that I want to show you that help me with my arthritis that aren't drugs, because you have to bear in mind that there are some people out there who don't want to become dependent on drugs. I feel sort of semi-comfortable taking medicine, but I only want to take medicine if it works, because especially when you're taking like hardcore medicine like the naproxen, the like double strength ibuprofen, the injection that I can't say the name of, it can really like damage your body, and I don't want to put myself through that unless it's working for me. And I think there are some people who feel like that, and there's some people who are just really against medicine, and that's okay. And there are other things that you can do to help. I mean, they may not be effective as medicine, but I think as well, if you're around someone who's got a long-term condition, autoimmune disease, something like that, you need to be really understanding of what their choice is, because it is their choice at the end of the day. It's their body. If you want someone to feel good, you're gonna want them to do the thing that you think is best, but they may not want to try medicines that they know that will work because they don't agree with medicine or something like that, or they don't want to put their body through that, or they don't want to experience the side effects. And I think if you're around someone who's like going through that, trying to decide what they want to do. You just need to support what they want. I mean, it is their choice at the end of the day. I'm really grateful that my whole family was just really understanding of all my choices, and that they were just like, my dad is a big believer in exercise, and that exercise helps you. And so when I sort of went to the doctor, physio isn't working for me, it's just not my thing, he was a bit disappointed in that, but at the same time he was really supportive of just that that's not what works for me, that's not what I want to do. It works for him, but it doesn't work for me. And you need people around you who are going to support what you want out of like your treatment, because there's no point in taking a medicine because it's going to make you feel better but then mentally you're going to feel worse. That's not the point. So things that I find that really help me that aren't like medicines, physio, well, the first one sort of is a medicine. This is sort of like ibuprofen gel, or like Bonjela if you've seen that, and it's sort of just like a painkiller that you like apply to your skin. This is ketoprofen, which I think is just a bit stronger than ibuprofen. But I find this works. It's not amazing, but it's just like a little gel like this, and you put it on and it sort of works. And if I don't want to take medicine that day, it's really good. Or if I've got like really specific pain, it does work. So it does work. So I would recommend that. Other little things that aren't medicines that I do is, this is really random. I like this tea. It's the Tetley like Immune with Vitamin C tea. I like have a cup of this every day because, well, for two reasons. Firstly, I feel like if you get a cold or you feel slightly ill and then you're in pain as well, it just feels so much worse. So I'm a bit of like a germaphobe. I don't share drinks with people. I carry hand sanitizer with me everywhere, because if I get a cold, it just makes me feel absolutely rubbish. It makes my pain worse as well. And so by taking this tea, I think it does actually help your immune system, and it's got vitamin C in, so how can you go wrong? It's probably a bit psychological, but it's just like, I'm being haunted.
This week on BuzzFeed and
Little thing that will help you feel better, because getting a cold is a bigger thing. Like if you've got a condition or an autoimmune disease or anything like that, getting the cold will have a big effect on how you live your life. So that tea just tastes really good. I can't even lie. I mean, there's other similar things that you can take. And also what I found helpful was that I got a blood test, and they just told me what I was lacking in vitamins and everything, so I could take those, and it does make you feel better. Like I got a blood test and I was lacking in B12, which is this spray that I'm also going to talk about, and it just makes you feel rubbish. Like when I started taking this, I felt so much better. It just makes you feel so tired, and if you've got like, if you don't have a condition, it's probably not going to affect you that much, but if you're already going through pain, it's really important to just make sure, other than your condition, you're in the best health that you can be, says me. Yeah, so this spray is just like literally from Boots. It's B12, you literally spray it in your mouth, but it's just got better absorption than taking tablets. And also prefer it because I feel like when you take a tablet it feels like you're taking medicine, but that's just me. I don't, yeah. And this is like the last thing, like little heat up things that you just chuck in the microwave and they're warm. They feel so good. Like I can't explain how much heat like makes my joints feel better. Like I'm not a huge lover of foreign countries because I don't like sweating, really gross. But anyway, I like the one thing when I go to a different country, I feel the benefit is like the heat in my joints just makes me like feel so much better. And I think that that's not just specific to like spondyloarthritis. Like I think that's the same for rheumatoid arthritis, for other conditions. Like if you've got a generalized pain condition, heat really helps. So like little heat up hot water bottles, having hot baths can really make you feel better as well. And as well, just keeping warm. Like just wear a coat if you want to wear a coat. Like people always like judge me because I wear my coat inside, but I get cold really easily and it makes me all sore. Thank you for watching this video. I hope it helped if you have a condition like mine or know someone who does, or are literally just like interested about it. If you have any questions, you can comment them or like DM me on Instagram. I'll put my Instagram like in the thing down below. Yeah, and if you could like share this video so the people who need to see it can see it, that would be really helpful. Goodbye.